Good afternoon, St. Pete. This is Mayor Rick Kriseman joining you live from our city's Emergency Operations Center with a brief update on the COVID-19 status in our community. So here are the latest numbers for Pinellas and St. Petersburg. There are now 8,259 confirmed cases in Pinellas County. Nearly 200 people have lost their lives to this virus here in Pinellas County. 75% of those deaths are related to long-term care facilities. In St. Petersburg, there's now more than 4,000 cases that have been confirmed. We continue to see cases rise in some of our southernmost zip codes and disproportionately among African Americans, and as such, we continue our outreach in those areas. Our current hospital capacity is as follows. There are 265 hospital beds available in St. Petersburg. 26 ICU beds are available in St. Pete, but there are nearly 50 ICU beds countywide that are available. Our 2-week rolling percentage of positive cases is just over 12%. And again, it is our goal to get this percentage down under 5%. And our hope is that we begin to see some positive changes in our data within the next week or two as a result of our mask mandate. Now, as I move around the city, I am pleased to see mask usage has increased. And please continue to wear one when you're indoors and when you're near others. We are also continuing to give away city-branded masks that have come from private sources at locations throughout the city. So to learn where to find a city-branded mask, please visit restartstpete.com. Again, that's www.restartstpete.com. Now, should we run out of the branded masks, the city has plain white masks that are available as well. Now, as you know, one of our goals is to also see an increase in testing here in St. Pete. And we are thankful to Baycare for the many tests they have administered at Tropicana Field. We are also working with the state and our county partners to get a testing site running at full speed at the Mahaffey Theater. So please be on the lookout for details related to that. And finally, I want to thank all of those who attended the opening of the St. Pete Pier last night. Now, due to COVID-19, we chose not to hold a celebratory event, but we certainly expect there to be plenty of opportunities for that in the future. And as a reminder, the Pier District should be treated like any other open space in St. Pete. While we are limiting occupancy, we still need you to wear a mask when near others, and we still need you to wear a mask indoors when you're not eating or drinking. Now, I was generally pleased with what I saw last night, but I know we can do better within the Pier District and elsewhere throughout the city. Our Pier Rangers will continue to remind folks to socially distance. Our police will respond to calls to our non-emergency number should an employee or patron of a restaurant refuse to wear a mask. All the rules that apply to the rest of the city apply to the Pier District. And even our tenants at the pier are being reminded that they too must abide by the same orders. Now, the great thing about the Pier District is it provides us with 26 acres overall, 6 more acres of green space to roam and to spread out. So please enjoy it, but again, be smart, wear your mask. And so now, as I always do, I'm going to turn to Yolanda Fernandez, who has some questions that we've received from the media. Yolanda?
Mayor, our first question is from 10 Tampa Bay. The virus is spreading rapidly in the county and hospitals are having a hard time keeping up. Are you concerned?
You know, I've been concerned really with our hospital capacity since mid-March. I do know that hospitals are beginning again to discontinue elective surgeries, which I think really is the right thing for them to be doing. Our main concern really is with our vulnerable population. They are the ones who are more prone to getting, when they get the virus, for it to be much more significant and serious, and oftentimes, and sometimes it causes death in that age group in particular, our more vulnerable population. But again, we're seeing the big numbers, 15 to 24, 25 to 34, and that age demographic is still our highest number. So We need those folks to do a better job of social distancing, wearing the masks. We don't want you coming home and giving it to grandma, grandpa, mom, or dad, because those are the ones and those are the folks that are going to overwhelm our hospitals.
Our next question is also from 10 Tampa Bay. The mayor of Miami-Dade is scaling things back and closing down places that could be hotspots for COVID-19. Will you do the same? When will it get to the point that more action needs to be taken?
So I've been pretty consistent in this comment. I prefer that we have statewide uniform policies. If we can't have a statewide policy, I'd like to see a regional policy. If it can't be regional, then we'd like to see it countywide. And certainly, if it doesn't happen, St. Pete will lead the way, and we'll take action if we need to. That's what we've done throughout this pandemic, and we've seen others that have followed suit after we've taken action. I do think that if the data that we see in the next week or two shows us that the mask mandate is not working, that we're going to end up having to take some additional actions.
Our next question is from Telemundo. Do you agree with the recent statewide order of kids returning to school?
Yeah, I think it's that order came out earlier than I certainly would have expected, especially when you see the rise that we've seen throughout the state of Florida in the number of positive tests and the number of positive cases. The one thing about that order is it appears to give individual school districts some flexibility. So that is a good thing because I think that if we don't see these numbers decrease, our districts are going to need that flexibility as opposed to having to send our kids back to school. I think there would be a lot of parents that would be upset about that. I do think what's interesting here, though, and there's a pattern that we've seen, is that for whatever reason the governor seems to be distancing himself from making these consequential decisions. This order related to schools was done by the education commissioner, wasn't done by the governor. And the previous order related to restaurants and bars was done by the Department of Professional Regulations and not by the governor. I think it's more appropriate that the governor be the one that is entering these orders. They impact the whole state. He is the leader of our state. I think he should be the one entering them. But having said that, again, I'm glad if there was an order related to education that it at least gives each of our school districts the flexibility. Because I think here in Pinellas County, if we don't see the numbers go down, I don't know how comfortable I would be sending my child to school. And I think a lot of other parents would feel the same way.
No more questions, Mayor.
All right. Thank you, Yolanda. You know, friends, I know none of us, including me, enjoy wearing a mask or keeping socially distanced from friends or even family. I know when you're outside in the hot sun, it's even harder and it's more uncomfortable wearing a mask. But I want you to remember, if we can put up with being uncomfortable for hopefully only a little while longer, we can prevent going back to where only essential businesses are open, we can save lives, and we can reclaim a greater sense of normalcy. If anyone can do this, it's us, St. Pete. Thank you all.